It is important to acknowledge the roles that women play.
Speaking with patients about their roles and responsibilities is essential.
And it's important to get that information. And the way we get it is by having frank conversation. Please tell me about, your day to day.
In order to understand someone's activities, their challenges, their stressors, that's all directly related to their health.
And what we know from the data is that gender minorities, women, often have high levels of stress that then impact their health in many different ways. Historically, women presenting with shortness of breath of all types been attributed to other things like anxiety, stress, etc.
I have noticed that women tend to report less symptoms, so it's super important to really ask specific questions about symptoms.
And so to make sure that we as healthcare providers and as healthcare systems really check our biases and really listen to our patients and do what's necessary to make sure that we definitively diagnose and appropriately treat their underlying lung process.
And emphasize how treatments may lessen these symptoms and lead to more productive work or daily life. If the pandemic has taught us anything, it's how vital our individual health is. Anyone juggling so many responsibilities and stressors has a lot of challenges in terms of taking care of themselves.
You have to figure out, working with the patient, what is the best way to help them be compliant. So getting some insight into the patient's day-to-day and the stressors and the challenges they face definitely are important to understand how we together can create a successful treatment plan.
And how essential it is that we care for ourselves in order to be able to best care for others.